Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement. As we grow older, maintaining strength and balance becomes more important than ever. It's not just about exercise, it's about independence, confidence, and the ability to live life on your own terms. Many older adults begin to notice changes over time. Muscles feel weaker, joints become stiffer, and everyday movements like getting up from a chair or walking across the room start to feel more difficult. But aging doesn't have to mean losing your strength. In fact, with the right daily habits, your body can stay strong, mobile, and full of life at any age. That's why today we're introducing 3 simple yet powerful leg exercises that every senior should do daily: chair sit to stand, standing heel raises, and seated leg extensions. Each one is safe, low impact, and scientifically proven to help improve lower body strength, enhance balance, and reduce the risk of falls. You don't need a gym equipment or even a lot of space. Just a sturdy chair, a few minutes each day, and a willingness to care for your body. With consistent practice, these movements can make a real difference, helping you move more confidently, climb stairs with ease, and stay independent longer. It's about taking small, steady steps toward a healthier, more active version of yourself. So as you follow along today, listen to your body, take your time, and celebrate every repetition, because each one is an investment in your future strength and freedom. If you find this video helpful, please like, share, and subscribe to our channel. It really helps us continue creating more health and exercise videos for seniors like you. And don't forget to check out the rest of this playlist for more simple routines designed to support your legs, joints, and overall well-being. Together, let's make movement a daily habit for a stronger body, a clearer mind, and a more joyful life. Now let's begin. Exercise 1. Chair sit to stand. Characterization and functional significance. The chair. Sit-to-stand movement is an essential element of functional fitness. It replicates the mechanics necessary to ascend from seated surfaces commonly found in daily life, such as chairs, toilets, and automobile seats. The capacity for independent standing is essential for autonomy. Thus, consistent practice of this activity improves the requisite muscle strength, balance, and motor control for self-sufficient living. The exercise necessitates no specialist apparatus. A stable, suitably sized chair is adequate, rendering it accessible to the majority of older persons. Biomechanics and primary muscles engaged. The sit-to-stand is a synchronized multi-phase movement that entails concentric and eccentric muscle activities across several joints. It predominantly activates the muscles responsible for hip and knee extension and necessitates core stabilizers to uphold proper torso alignment. Stages of the movement: concentric phase ascent. In the transition from sat to standing, concentric shortening contractions of the hip and knee extensors produce the force required to lift the body against gravitational resistance. Eccentric phase descent. Resuming the seated position necessitates regulated, lengthening, eccentric contractions of the same musculature to decelerate the body and safely absorb impact. Principal muscular contributors: quadriceps, femoris rectus, femoris vastus lateralis, vastus medialis, vastus intermedius, principal facilitators of knee extension; gluteus maximus, the primary hip extensor that generates torque as the torso transitions from flexion to an upright position; hamstrings facilitate hip extension and aid with knee stabilization. The erector spinae and paraspinal muscles assist in sustaining trunk posture and safeguarding the spine against excessive bending. The core musculature transverse abdominis obliques rectus abdominis stabilizes the pelvis and trunk isometrically, so providing a foundation for limb force generation. Physiological and functional advantages. The consistent execution of the chair sit-to-stand exercise yields multiple interconnected advantages. Enhanced lower body strength. Utilizing body weight as resistance augments the capacity of the quadriceps, glutes, and hamstrings, hence improving walking speed, stair climbing proficiency, and the energy expenditure of daily activities. Improved balance and proprioception. The sit-to-stand movement necessitates ongoing changes to sustain the center of mass above the base of support, thereby pushing proprioceptive feedback and postural control systems in a functionally pertinent context. Enhanced bone loading. As a weight-bearing activity, repetitive sit-to-stands exert mechanical stress on the hips and legs. Bone adapts to regular loading, which may aid in maintaining or slightly increasing bone mineral density. Enhanced functional independence. Fortifying certain muscles and neuromuscular patterns immediately facilitates the execution of routine activities of daily living. Metabolic and cardiovascular activation. Engaging big muscle groups temporarily elevates metabolic requirements and over time enhances glucose regulation and promotes moderate cardiovascular conditioning. Neuromuscular adaptation. Repeated practice enhances coordination, timing, and intermuscular recruitment patterns, hence diminishing dependence on compensatory techniques that elevate fall risk. Comprehensive procedural guidelines and pragmatic recommendations. Setup. Select a stable non-wheeled chair situated on a non-slip surface or secured against a wall. The chair height must enable the feet to rest flat on the floor with the knees positioned at approximately a 90-degree angle while seated. If a participant's chair is excessively low, a sturdy cushion or folded towel beneath the hips can raise the seat. If it is too high, go for a lower chair. Initial position. Position yourself at the front edge of the chair to facilitate hip extension. Position the feet hip-width apart somewhat posterior to the knees and flat against the floor. Uphold an erect chest and a straight spine. The shoulders must be relaxed and positioned slightly posteriorly. To increase difficulty, cross the arms over the chest. For initial assistance, place the hands on the thighs. Commencing the ascent, incline the torso forward from the hip joints while preserving a neutral spine. This repositions the center of mass over the feet and prepares the lower limbs for extension. Engage the core and exert pressure through the heels to stimulate the posterior chain. Refrain from utilizing momentum through rocking. The motion should be predominantly propelled by the legs and hips. Finalizing the ascent. Elevate until the hips and knees are completely stretched, resulting in an upright posture. Maintain a neutral pelvis and refrain from hyperextending the knees. Adopt an erect posture and regulate your breathing. Commencing the descent. Start by retracting the hips as though extending towards the chair. Preserve an erect posture and regulate the fall by eccentric contraction of the quadriceps and gluteal muscles. Executing the descent. Gradually lower oneself until a soft touch with the chair surface is achieved, maintaining muscle engagement until fully seated. Avoid descending abruptly. The muscles should regulate the descent continuously. Breathing. Exhale during the concentric phase ascending and inhale during the eccentric phase descending. Ensure continuous respiration instead of breath retention. Volume recommendation. It is advised to aim for 50 repetitions every session. This can be divided into reasonable subsets based on individual capabilities, such as 5 sets of 10 repetitions with short pauses between sets, 2 sets of 25 or several mini-sessions throughout the day, e.g., 10 repetitions 5 times. Consistency and the quality of movement are paramount compared to the volume of a single session. Frequent mistakes and pragmatic remedies. Excessive anterior knee translation. Refrain from exerting force through the toes and permitting the knees to advance unduly beyond the toes. Rather, prioritize propulsion through the heels. Sense the ground beneath your heels and exert pressure backward through them. Avoid excessive trunk flexion or rounding. Maintain an elevated chest and a neutral spine to prevent forward bending of the back. Visualize a cord elevating your chest. Momentum-driven ascent. Refrain from utilizing momentum rapid rocking to achieve an upright position. Promote a gradual, controlled elevation facilitated by muscular strength. Gradually engage your legs rather than relying on a rigid stance. Asymmetrical loading. Monitor for weight displacement to one leg. Guarantee uniform distribution and equal force application across both feet. Apply equal pressure through both feet. Excessive downhill speed. Regulate the descent to improve eccentric strength and mitigate impact. Alterations and advancements. Simplified alternatives. Utilize chair arms for support. Execute partial sit-to-stands. Elevate only partially or elevate seat height to diminish range of motion requirements. Execute a reduced number of repetitions every set while increasing the total number of sets throughout the day. Intermediate progressions. Eliminate arm support, cross the arms over the chest, execute slower tempos, or incorporate a 1 to 2 second stop at the halfway to enhance stability challenges. Advanced progressions. Gradually decrease the chair height, execute single-leg stands only when balance and strength are adequate, or incorporate minimal external load light-weighted vest or small weights. Only once consistent safe technique is established and with physician authorization. Discomfort or surgical considerations. For recent joint replacement or ongoing discomfort, restrict range of motion, utilize an elevated seat and adhere to clinician-recommended protocols. Decrease frequency if discomfort continues beyond 48-72 hours. Exercise 2. Standing heel elevations, calf lifts. Characterization and functional significance. Standing heel raises target plantar flexion at the ankle, fortifying the principal calf muscles responsible for the push-off phase of gait, facilitating minor yet essential postural alterations, and aiding venous return from the lower extremities. The exercise is low impact and adjustable, making it particularly appropriate for older persons needing enhancements in ankle strength and postural control. Biomechanics and primary muscles engaged. The exercise focuses on plantar flexion, the movement where the dorsum of the foot and toes extend away from the tibia, elevating the heels. Primary muscles, gastrocnemius, the superficial biarticular muscle traversing the knee and ankle joints, generates significant plantar flexion when the knee is somewhat stretched and aids in push-off. Soleus, positioned beneath the gastrocnemius, this robust single-joint plantar flexor is predominantly engaged when the knee is flexed and during minimal postural activities. Auxiliary muscles. The tibialis posterior flexor, hallucis longus, and intrinsic foot muscles contribute to foot stability throughout the movement. Physiological and functional advantages. Standing heel raises offer numerous benefits pertinent to older adults. Ankle strength and stability. Fortifying the gastrocnemius and soleus muscles improves the ankle's ability to withstand disturbances and uphold proper alignment. Enhanced equilibrium through proprioception. The foot and ankle house numerous sensory receptors. Heel raises stimulate these receptors and refine the neuromuscular responses employed for balance adjustments. Fall prevention. An efficient ankle technique. Rapid plantar flexor contraction mitigates body tilt when balance is compromised. Improved venous return. The calf muscle pump facilitates the movement of blood towards the heart. Consistent contraction and relaxation diminish lower limb edema and promote circulatory health. Enhanced propulsion during ambulation. More robust plantar flexors facilitate a more powerful and efficient push-off, hence augmenting walking velocity and stamina. Comprehensive procedural guidelines and pragmatic suggestions. Set up position yourself adjacent to a countertop, the rear of a robust chair, or a wall for minimal support. Utilize support solely for stabilization, not to elevate the body. Initial position. Stand with feet hip-width apart and parallel shoulders aligned over hips, core slightly engaged, and maintain an upright posture. Implementation. Gradually apply pressure through the balls of the feet to raise the heels as high as comfortably achievable, concentrating on squeezing the calf muscles. Pause momentarily at the apex 1 to 2 seconds. Gradually and deliberately lower the heels to the floor, avoiding a rapid descent. Respiration. Exhale while ascending and inhale while descending. Technique cues. Maintain weight distribution over the forefoot, prioritizing the big toe and second toe for enhanced stability. Refrain from ankle inversion or eversion. Recommended volume, a total of 50 repetitions is advised, divided into sets, for instance 5 sets of 10, or collected throughout daily activities. Alterations and advancements. Decrease demand. Execute seated calf raises to minimize balance needs while effectively engaging calf muscles. Enhance difficulty. Advance to single-leg heel rises. Execute raises on the edge of a step to augment range of motion, permitting heels to descend below step level prior to elevation, or incorporate light external resistance ankle weights if bilateral form is established. Progressive overload. Augment time under stress by decelerating the descent, eccentric phase to 3 or 4 seconds, or include a 2-second isometric hold at the apex. Functional integration. Execute sets during ordinary standing activities, e.g., cooking, brushing teeth, or waiting in line to amass volume without requiring dedicated workout time. Exercise 3. Seated leg extensions. Characterization and operational significance. Seated leg extensions target the quadriceps to enhance knee extension while reducing stress on the hips and spine. The exercise is suitable for persons with balance issues, hip soreness, or those who struggle with standing exercises, as it can be performed while seated and does not necessitate standing balance. Enhancing quadriceps strength bolsters knee joint stability during ambulation and stair navigation, while alleviating functional complaints linked to degenerative knee disorders. Biomechanics and primary muscles engaged. This movement is an open-chain exercise wherein the distal segment, the foot, is unrestrained and can move freely through space. Principal muscle group. The quadriceps femoris comprises 4 heads: vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris, which collectively function to extend the knee. The vastus medialis plays a crucial role in patellar tracking and provides medial support to the knee. The rectus femoris traverses both the hip and knee joints, facilitating hip flexion. When seated, its primary function is knee extension. Physiological and functional advantages. Knee joint stability and shock absorption. Robust quadriceps enhance dynamic knee stability and assist in dissipating stresses that would otherwise impact articular cartilage. Improved gait and stair climbing ability. Quadriceps strength facilitates safer ambulation and ascent activities. Circulatory and metabolic advantages. Engaging substantial thigh muscles enhances localized blood circulation and mitigates sarcopenic degeneration. Accessibility and safety. The seated posture diminishes the danger of falls and is suitable for various functional capabilities. Comprehensive procedural guidelines and pragmatic suggestions. Position yourself at the front edge of a sturdy chair, ensuring your feet are flat on the floor and your hips are at a roughly 90-degree angle. Uphold a neutral spine by activating the core. Refrain from reclining against the chair for support. Initial position. Hands may be placed on the chair's sides or the thighs for support. The feet ought to be positioned hip-width apart. Execution alternating limbs. Gradually extend one leg forward until the knee is comfortably straight, avoiding hyperextension. At the apex, deliberately engage the quadriceps and maintain the contraction for 1 to 2 seconds. Gradually lower the leg to place the foot back on the floor. Alternate with the opposing leg. The extension of each leg sequentially forms the training regimen. Respiration. Exhale during extension and inhale during descent. Volume recommendation. A target of 50 total repetitions is advised, comprising about 25 extensions per leg when alternating. Technique precautions. Refrain from swinging or employing momentum. Proceed with caution and intention to enhance strength and tendon adaptability. Advancements and options. Resistance enhancement, incorporate light ankle weights or a resistance band, or reduce the tempo to prolong time under tension. Limited range or isometric exercises. Partial extensions or prolonged isometric holds 5 to 10 seconds can enhance endurance and strength while minimizing excessive joint movement. Alternative movements. If sitting is inadvisable, consider performing straight leg lifts in a supine posture under clinician supervision. Be aware that this modifies muscle recruitment and core requirements. Incorporating the triadic exercise regimen into quotidian activities. The ease and portability of the 3 workouts facilitate their integration into regular routines. A pragmatic daily session may encompass warm-up 2 to 5 minutes. Initiate with mild dynamic exercises to enhance circulation and prepare the joints. For instance, gentle marching in place, ankle rotations, hip rotations, shoulder rolls, and vigorous arm swings. Warming up alleviates stiffness and prepares the neuromuscular system. Main set, chair. Sit to stand 50 total repetitions divided as necessary, e.g., 5 sets of 10 with 30-60 seconds of rest between sets or 10 repetitions performed 5 times during the day. Standing heel raises 50 total repetitions, preferably executed with a slow regulated tempo, e.g., 5 sets of 10. Seated leg extensions, 50 total reps, 25 per leg when alternating, executed with intentional eccentric control. It is permissible to alter the sequence of exercises to align with individual preferences or to mitigate tiredness. For instance, commencing with seated leg extensions may alleviate knee joint discomfort prior to engaging in standing activities. Cool down and mobility. 2 to 5 minutes. Conclude with easy stretches for the calves and quadriceps, ankle mobilizations, and deep breathing to facilitate recovery. Examples comprise a standing calf stretch against a wall utilizing support and mild quadriceps stretches while standing with assistance or momentarily lying prone as suitable. Exemplary daily itinerary. Morning upon awakening. Warm up, then perform 10 chair. Sit to stand repetitions and 10 seated leg extensions, alternating legs. At midday, during lunch preparation or while waiting for the kettle, perform 10 standing heel raises and 10 chair sit to stand repetitions. Afternoon, 10 seated leg extensions and 10 standing heel raises. Evening before to dinner or bedtime, 20 chair sit to stand repetitions, 20 standing heel raises, and concluding mobility stretches. This distribution facilitates the accumulation of the goal volume without inducing excessive tiredness and strengthens habit formation by associating exercises with everyday routines. Frequency, recuperation, and indicators for modification. Engaging in the regimen daily or on most days is typically suitable for numerous older folks as the workouts are low impact and predominantly body weight oriented. Daily practice fosters consistent neuromuscular activation, hence aiding in the maintenance of balance, proficiency, and functional strength. Nevertheless, modifications are justified if atypical pain occurs, novel, acute, or joint line pain persisting beyond 24-72 hours. Noticeable edema or ongoing rigidity manifests. Dizziness, chest pain, or cardiac symptoms manifest during or following physical activity. Fatigue impairs safe execution. Should any of these events transpire, diminish the frequency. For instance, every alternate day, lessen the volume or seek advice from a healthcare professional. Recovery is personalized and affected by initial fitness levels, comorbid conditions, medication impacts nutrition and sleep. Schedule rest days or lighter workouts when weary or when implementing new higher-intensity progressions. Oversight of advancement and assurance of safety. Maintaining straightforward objective indicators of progress sustains motivation and guarantees that the program yields significant enhancements. Pragmatic metrics encompass repetition quality, monitoring the ability to finish the entire prescribed set with consistent form and without compensatory movements. Functional assessments, variations in the duration required to perform 5 sit-to-stand repetitions, enhancements in customary gait velocity over 4 meters, or outcomes from the timed up-and-go tug test. Endurance metrics, enhanced capacity for uninterrupted repetitions achievable without breaks or decreases in perceived exertion at a consistent workload. Subjective measures. The perceived ease of performing daily activities, including rising from chairs, ascending stairs, or walking extended distances. Adverse indicators. Joint edema, heightened discomfort, vertigo, considerable dyspnea or palpitations during or following physical activity necessitate medical evaluation. Effective logging procedures include a daily checklist, a concise diary, documenting completed repetitions and perceived difficulty on a scale of 0-10 or periodic timed assessments conducted every 2 to 4 weeks to measure progress. Regular evaluations with a doctor or therapist provide essential objective insights into improvement. Pre-exercise safety checklist. Environment: remove tripping risks from the exercise area, ensure sufficient illumination, and wear secure non-slip footwear. Utilize a level non-skid surface. Chair stability. Utilize a stationary chair on an even surface. Ensure the steadiness of the stride and the availability of hand support when performing heel lifts. Support surfaces. Utilize counters or robust furniture for balance. Help but refrain from using the hands to pull the body upward. Support should be minimal. Hydration and pharmacological considerations. Remain cognizant of the impact of drugs on equilibrium or cardiac rhythm. Ensure enough hydration and refrain from vigorous exercise immediately following substantial meals if susceptible to vertigo. Medical clearance: individuals with unstable heart conditions, uncontrolled hypertension, recent significant operations, or acute musculoskeletal injuries must secure clearance prior to commencing or intensifying exercise. Modifications for prevalent situations. Balance impairment. Initiate with assisted standing exercises, proceed to sitting variations, and refrain from single-leg advancements until deemed safe. Gait belts and monitored assistance are suitable for persons at elevated risk of falls. Knee osteoarthritis. Prioritize pain-free ranges of motion, implement partial sight-to-stands, and concentrate on sitting leg extensions. Gradual, deliberate repetitions facilitate strength development while minimizing stress on structures. Hip discomfort or recent hip replacement. Utilize elevated seating to minimize hip flexion, execute partial ranges of motion, and advance in accordance with postoperative guidelines under clinician supervision. Peripheral neuropathy. Enhanced dependence on visual and tactile stimuli. Gentle fingertip touch with a steady surface and minimize unsupported movements until sensory perception or balance is restored. Osteoporosis. Refrain from abrupt, uncontrolled motions and gradually include resistance. Prioritize posture and regulated loads to mitigate fracture risk. Seek clinical advice if vertebral fracture is a concern. Cardiovascular constraints. Assess perceived exertion and, if advised, heart rate. Commence with minimal quantities throughout the day and advance incrementally as tolerance permits. Illustrations of advancement techniques. Advancement ought to be gradual and tailored to the individual. Strategies encompass progression by repetition. Introduce minor increments such as 5 additional repetitions weekly while ensuring proper form before further increasing volume. Tempo manipulation. Extend the eccentric phase to 3 or 4 seconds to enhance time under stress and eccentric strength. Isometric holds and pauses. Incorporate 2 to 3 second holds at the halfway or apex of movements to enhance strength at pivotal joint angles. Load introduction. Introduce little external resistance such as light ankle weights, a small weighted vest, or a light object only after achieving consistent and safe proficiency in body weight variations. Motor learning variability. Engage in practice at various seat heights, alter foot positioning from narrow to broad, and progressively introduce controlled sensory obstacles, e.g., diminished visual input, ensuring supervision throughout. Dual task training. After establishing baseline competency, integrate uncomplicated cognitive tasks throughout exercises to replicate real-world multitasking and improve resilience. Behavioral tactics to enhance compliance. Adherence is the most significant factor influencing benefit. Strategies to enhance sustained practice encompass habit stacking. Combine exercises with existing daily routines, such as after brushing teeth while cooking food or during phone calls to create automatic prompts for the activity. Define specific quantifiable objectives. Establish targets related to repetitions, frequency, or timed assessments, and systematically track progress using a calendar, checklist, or application. Social reinforcement. Engage in exercise with a partner, family member, or small group whenever feasible. Social accountability and motivation enhance perseverance. Rewards and recognition. Commemorate milestones with modest, significant rewards to maintain motivation. Alter the variety and context. Periodically modify the surrounding sequence or pace to mitigate monotony while maintaining fundamental workouts. Professional coaching. Regular assessments with a physical therapist or fitness teacher can enhance technique, direct progressions, and offer motivation. Clinical and functional outcome metrics for monitoring. 5 times sit-to-stand test duration required to complete 5 repetitions from a seated position, an effective assessment of lower limb strength and functionality. Timed up and go. Tug duration required to rise, traverse 3 meters, pivot, return, and sit, a proven indicator of mobility and fall risk. Gait velocity. Standard rate over 4 meters. Alterations of 0.1 ms are deemed clinically significant. Repetition endurance. The highest number of repetitions executed with proper form prior to tiredness. Patient-reported functionality. Concise self-assessments or questionnaires regarding challenges with stair navigation, chair elevation, and ambulation. Illustrative cases and pragmatic modifications. Case A. Independent, older adult with deconditioning initiate sitting leg extensions and partial sit-to-stands, collecting repetitions throughout the day. Incrementally increase seat height and standing repetitions. Begin heel rises in a seated position advance to supported bilateral standing and thereafter transition to full bilateral standing, raises when tolerated. Case B, moderate balance impairment and fear of falling. Prioritize seated workouts and seated heel raises at the outset. Utilize an elevated chair for sit-to-stand transitions and countertop hand assistance. Utilize shorter, more frequent sessions to enhance confidence and mitigate weariness. Case C, post-hip replacement. 6 to 12 weeks post-operatively. Adhere to surgical precautions. Commence with sitting leg extensions and facilitated sit-to-stands from an elevated surface. Refrain from excessive hip flexion in the initial stages. Advance with clinician feedback and assess incision discomfort, edema, and ambulation. Case D, peripheral neuropathy with diminished proprioception. Depend on visual cues, utilize minimal hand support. Refrain from single-leg exercises until sensory function enhances and contemplate balance aids during advancement. Illustrative 8-week progression plan. Weeks 1 to 2. Emphasis technique, baseline volume habit development. Sit to stand 5 sets of 6 to 8 repetitions spread throughout the day. Heel raises 4 sets of 8 to 10 repetitions with support. Seated leg extensions. 4 sets of 8 to 10 repetitions, alternating legs. Highlight the importance of warm-up and cool-down exercises. Weeks 3 to 4. Objective enhance volume and tempo regulation. Sit to stand, 4 sets of 10 repetitions or 2 sets of 15 as tolerated. Heel raises. 5 sets of 10 repetitions incorporate brief holds at the apex. Seated leg extensions, 5 sets of 10 repetitions, 25 total each leg. Implement gradual eccentric control, 3 seconds descent. Weeks 5 to 6, emphasis implement incremental advancements. Sit to stand 5 sets of 10 repetitions or 1 set of 50 throughout the day. Heel raises 5 sets of 10 repetitions incorporating 2-second holds. Initiate partial single leg raises if deemed safe. Seated leg extensions, 5 sets of 10 repetitions with modest ankle weights if tolerable. Weeks 7 to 8. Emphasis integration and operational difficulty. Sit to stand advance to reduced seat heights or perform half repetitions at a deeper range. Heel raises, unilateral raises 3 to 5 per leg, in addition to bilateral sets. Seated leg extensions augment resistance and duration of strain. Reevaluate functional assessments, 5x sit-to-stand gait velocity, timed up and go test. And that concludes today's practical guide to strengthening your lower body, a simple yet powerful 3-part routine designed to help you stay strong, balanced, and independent at any age. By practicing chair sit-to-stands, standing heel raises, and seated leg extensions. Regularly, you're not just training your muscles, you're protecting your mobility, your confidence, and your freedom to move through life with ease. Remember to go at your own pace, focus on proper form, and listen to your body. Even small, consistent steps can bring remarkable improvements over time. If you found this video helpful, please like, share, and subscribe to our channel. It's the best way to support our work and ensure you never miss the next wellness lesson. And don't stop here. Check out the other videos in this playlist for more safe, effective exercises designed to keep you active, energized, and healthy every day. Every day you choose to move, your body responds with strength, balance, and renewed life. Each gentle motion is a gift to yourself, calm, mindful, and full of vitality. Together we move, we heal, and we thrive. Keep the rhythm of your golden years. Nurture health, cherish every movement.